So just briefly, just to mention the sponsoring human services nonprofits that are here this evening, Lamoille County Mental Health, Lamoille Restorative Center, Laraway Youth and Family Services, Lamoille Housing Partnership, Lamoille Family Center, Lamoille Home Health and Hospice, Central Vermont Council on Aging, Clarina Howard Nichols Center, the Manor, Capstone Community Action, and North Central Vermont Recovery Center. Now, the focus of the evening, human service nonprofits are mission-driven organizations where neighbors work together to build the well-being of the community and its residents. The hosting organizations that I just mentioned for this forum directly impact the lives of thousands of Lamoille County residents each year. People of all ages, from birth to end of life, from all walks of life, and a range of circumstances and with a range of needs. These organizations employ hundreds of local residents, impacting the local economy in significant ways. Human services is where the hard work of building and rebuilding well-being is done. These organizations have a critical role in creating a robust, thriving community that we have here in the Lamoille County, Lamoille Valley area. The organization sponsoring this discussion work well, and in their work to build well-being, Vermont's human service organizations rely on state grants and contracts to do their work. And we hope this evening that this dialogue will raise awareness of the shared work between elected officials and human service providers. Now, as the study hall monitor, we have rules. So the audience that's here this evening will have a chance to participate in up to 3 of these circle discussions with 3 different candidates. Each discussion will last for 15 minutes. Before we go any further, the facilitators that are here this evening, if you can just raise your hand so everyone knows who you are. Thank you. So each discussion will last for 15 minutes, and we do urge you, the audience, that when you sit in a particular circle to remain. I really do sound like a teacher now. Please remain seated for the entire 15 minutes. I mean, because basically you don't want people wandering around while we're in the middle of a discussion. It's just very distracting. So if you can just stay put. And then at the end of that time, you will hear a bell. Naturally, we're in a school. And you'll be initiated to pass to the next circle. So you will be able to move around then. We do want you to consider which candidate you want to meet with and which topics and which issues are the most important to you. So there'll be 3 rounds and for 3 different sessions, and then afterwards we'll have kind of a wrap up. The facilitators will give like a synopsis of how they think the evening went. So.
I represent the whole county. Not technically Wilcott, but it feels like it, and that they call me like I'm their own, and I appreciate that. I feel pretty comfortable working around that. When in the Senate, we serve on 2 committees. My morning committee is transportation. My afternoon committee is appropriations. And between Senator Kitchell from Caledonia County and myself, our committee breaks the budget for human services up into areas. I have the DCF budget, I have the mental health budget, and I have aging and independent living. So a good chunk of the money that goes into human services I deal with every day in the Appropriations Committee, and am quite happy to be here and see a lot of friendly faces around the room. And I started my day with Savi and Lamoille Mental Health, and I'm kind of ending with that too. So thank you for inviting me.
Thank you. I'm Chip Troiano, and I represent Caledonia 2 District. I'm across the county line, and that is Hardwick, Stannard, and Walden. Of course, there's a connection. Hardwick obtains some of their services from Lamoille County. I'm seeking my 3rd term in the House of Representatives. I serve on the Human Services Committee, and I'm on the board of the Lamoille County Mental Health. And I retired from 35 years as a defense investigator at the Public Defender's Office covering the entire Northeast Kingdom, Caledonia, Essex, and Orleans County. And the connection is that in the course of those 35 years, lots of our clients needed human services and community services. So I had an attachment and a working knowledge of what goes on in the human services field before I actually was elected and assigned to the Human Services Committee. And I want to thank everyone for inviting me here, and I'll turn it over to whomever it is next.
Hi, my name is Todd Shove, and I'm the Democratic candidate running for Lamoille County State's Attorney. It's been my privilege to serve as a Deputy State's Attorney in Orleans County for about 2.5 years, and right here in Lamoille County for a little over 9.5 years. I look forward to the opportunity to be the State's Attorney. Thank you.
I'm Heidi Sherman. I'm the state representative from Stowe, running for my 7th term. I was first elected in 2006. And in my private life, I own and manage residential housing in Stowe, the majority of which is for low-income seniors, those with disabilities, and families. So I have a lot of familiarity with various topics we're probably going to cover tonight.
Hi, I'm Lucy Rogers. I'm running for the Vermont House of Representatives from the Lamoille 3 district, which is the towns of Cambridge and Waterville. My biggest memories in this room are taking the SATs here and taking my AP exams here. So I'm really looking forward to setting some new memories for this room tonight. And yeah, thank you so much for Roland, and thank you for the work putting this together. And I'm looking forward to this discussion tonight.
Hi there, I'm Avram Pat. I'm a candidate for the House from the Lamoille, Washington district. I served 1 term representing the district two sessions ago, and I was on the healthcare committee at that time. I have, in my most recent career was as general manager of Washington Electric Co-op, the state's most rural utility. But before that, I spent over 10 years in the Agency of Human Services. I was director of what was then a freestanding Office of Economic Opportunity, which was an appointed position then dealing with community action agencies, housing, homelessness, food and nutrition programs, and a lot of other things. And before that was the staff assistant to what was then the commissioner of the Department of Social Welfare, where I was dealing a lot with housing again, and energy, LIHEAP, and community action programs. And in our household, my wife retired a couple of years ago from state government, from the Agency of Human Services, DCF, Economic Services, and spent 10 years before that as Human Services aide on the Vermont staff of Senator Jeffords. So we talk a lot about and think a lot about the issues that are going to be talked about tonight.
Hi, I'm Dan Noyes. I live in Wolcott. I'm the representative for Lamoille 2, which is Wolcott, Hyde Park, Johnson, and Belvedere. I serve on the Human Services Committee, and I work for Central Vermont Council on Aging as the RSVP director. I've worked with many of you over the years, so it's good to see you all here, and thanks for having me.
Good evening. Thanks for everybody being here. I was born and raised in Jeffersonville, just down the street. I didn't graduate from here because the school wasn't built when I graduated. But I do have ties here because my mother was the first principal secretary here at Lamoille Union. I'm the incumbent, like Dave, from Morrisville, Elmore, Worcester, and Woodbury. And I serve on the Transportation Committee. And look forward to hearing from everybody here tonight about the different issues at hand.
Hello, my name is Marina Meerberg, and I'm running for the House seat from Lamoille 1, which is Stowe. I am a small business owner and a translator. I am the candidate, not the incumbent, and I really appreciate this initiative, and I look forward to the questions and the issues that are going to be discussed tonight. Thank you.
Hello, my name is Zach Mayo. I'm running to be state representative for Cambridge and Waterville. This is my first foray into politics, and it's my understanding this is a relatively unique forum, and I'm really excited about it. I think this is very interesting. I hope somebody will join me.
Hi, I'm Mike King. I'm running for House of Representatives in the Lamoille 2 district, which is Wolcott, Belvedere, Hyde Park, and Johnson. If I was to sum my campaign up in a couple words, one sentence, I guess I would say that I'm a working class Vermonter running to represent all working class Vermonters and not just the ones in my district.
Hi, my name is Matt Hill. I'm from Johnson originally. We live in Wolcott now, and I represent Johnson, Hyde Park, Wolcott, Belvedere, running for re-election. Let's see here. I'm a carpenter by trade, and I'm on the Laraway board, so it's exciting to see Laraway as a sponsor here too. So I'm looking forward to the great conversation, and I'm looking to learn a lot and also throw in as much of information that I know from my previous experience at the State House. Thank you.
Hi, I'm Betsy Anderson. I'm running for Lamoille County State's Attorney. To tell you a little bit about myself, I was born here in Lamoille County, grew up in Vermont. I'm currently at the Attorney General's office in their criminal division. Prior to joining the Attorney General's office, I was a prosecutor in New York in Nassau County for 6 years. I appreciate everyone coming out tonight. I'm excited to talk with people, and thank you to the Health and Human Services partners. And I hope I'm lucky enough to get to work with them in the future. Thank you.
Does anyone have a question you want to stop? Go for it.
What do you see as the biggest issue for housing?
Well, I'm going to break that up. I think it's a current issue, but it's going to get much bigger. And that's the issue of finding people who can help our elders. Not all elders need assistance with what we call activities of daily living, bathing, dressing, feeding, moving, etc. But many, many do. And if we're unable to provide assistance in the home, which is costly, they'll go into a nursing home, which provides great care, but it's even more costly. So it's really the demographic problem. I'd like to just quickly toss out not only that that's a problem, but also a potential solution, which comes with some controversy. Vermont, I used to be the director of the Vermont Refugee Settlement Program. Vermont has a history of welcoming people from all over the world who are usually in trauma. They get off the plane and they come from Africa and it's February. But I think eventually our country will figure out the immigrant problem, and hopefully it will be more kinder and gentler and thoughtful than what it is today. I'm not trying to go down that path and criticize anybody. But the answer is welcoming people from other countries who are coming to our country and invite them to Vermont. So imagine Lamoille County saying, we want to be a welcoming community. There's jobs. There's more nurse aid jobs than you can take a stick at. There's child care jobs. We can help acclimate you to our community, our culture, our ways, our morning, etc. And there's plenty of employment here. I think that's the answer to helping. We're, as many of you know, the second oldest state in America. And with age does not come feebleness. Is that a word? but I'll make it up if it isn't. It's travel. But there are more needs. People are going to need more help. Very, very troubling. And it's happening right now with people. I think the average age of a nurse in Vermont is like 49. That's not old, but it's closer that way. We need to say in the legislature this year, it sounds like I'm digressing, but hang with me. The legislature said, if you're in the National Guard, you get to go to any college you want, no charge. Because, it's a good thing to do, other states were doing it, and we were losing National Guard recruits to New York. Should we say, we want to go into nursing, I mean, that's one profession. Your tuition's completely paid for, you work here a minimum of 6 years, or else you owe it back. And the thinking is, in a 6-year period, you'll take risks, you'll strike up relationships, you'll become part of the community fabric, and you'll stay here. So human resources is a big issue. Cost is large, and we know. I'm going to stop soon because I have to check myself. Remember the number 1,534. 1,534 citizens of Mooresville last year, with a population of 5,500, give or take, had to use our community food shelters. Many of them were over the age of 65. Many of them. That's almost a third of the population in our town being to the point where they had to go to somebody else to feed themselves or their families. Hunger is an issue, but what's driving that is poverty. We have to have strategies to mitigate this, or it's going to become a Darwinian, each for ourselves, survival of the fittest. Not good. Should I stop? I'm up for air.
You almost got the card, but that's
okay. I almost got
very
it.
good.
How about the hook?
That's the next guy. Dave, so recently I spoke with Lori and Wayne.
Yes.
Meals on Wheels program for the senior citizens in Morrisville. And she said that transportation for the elderly to get to their doctor's appointments, to even get to food shelves, to the care they need, is very difficult. The RCT isn't able to cover most of that, even our public transit system. It just isn't quite enough. What do you think we could do in the future maybe to help that?
So RCT does a lot of, I've got a medical appointment in Burlington, can you take me? It's a great service. Our buses have their bus route, which is great, but the route is the route. And the concept that's used is something called on-demand transportation for people who have sufficient need that are in poverty. I'm going to digress though, because what's the answer to transportation? More transportation. How do you do that? It costs money. So I'm going to give my 60-second spiel on this. When the Trump tax cut went into effect in December, some 10,000 Vermont tax filers, which is about 350,000 tax filers, a small number of tax filers who earn over $215,000 a year are, for the next 10 years at a minimum, the beneficiaries of $237 million in tax breaks, cash in their pocket. Well, I want to raise the question, they're all good people, I don't want to hurt anybody. Heck, pick a number. 237 million, right? For people who make over 215,000. Let them keep 200 million. Could we take 37 million and begin to reinvest it in Vermont on these kinds of issues? Until we have a conversation, and it's very painful to do, at least it appears that it is, about redistributing income from those who have a lot to those who have a little. Pick the next issue, transportation, medicine, food, housing. They all take resources. There are those who say, almost done, there are those who say, but Dave, the wealthy will leave Vermont. I think they're going to leave their grandchildren for $4,000. That's what 37 million breaks in. If you figure that out. I don't think they're going to leave them. In fact, the data shows there's more people of means coming into Vermont than going out. So I just wanted to put on the table that I'm not one of these, socialist type, I want to take all your money. But we have to be realistic about where the wealth is going. And can some of it be used to address these issues? Because without it, we'll just have these little forums again every 2 years, and somebody else will be sitting there, and maybe somebody will be sitting different here and saying, transportation's a problem, we've got to address it. How? It's going to cost resources. More than what we have. Stop.
than 14?
Yeah, I think experienced workers are, well, not more than 14. I think we wouldn't like to see any more than 14. I think that experienced workers probably can accommodate that many. But the reality of the situation is that we need to make sure that when workers don't come in and complain to us. Their complaint is very interesting. It is that, not that they're overworked, but that if something happened to a child that was in their caseload, something drastic happened, that would be such a devastating blow and a burden to them they would have a problem with that. They didn't come in and tell us that they were overworked. The directors and the commissioners and the deputy commissioners are the ones that would come in and give us those numbers. But when we heard from workers, we would hear stories about, their ability or inability to get into the community to care for children and to make sure, again, to make sure that nothing happens on their watch that would be devastating to a family or to them.
It doesn't seem as though that they stemmed the tide with the crisis. I mean, from what you hear, what you read, it's still headed north as far as the extent of the opioid crisis and those that are affected.
Yeah.
And how do you go about reversing that? Certainly isn't putting more staff on. It's education, rehabilitation, those types of things.
Yeah, all the above. So, opening the new hub, medically assisted treatment hub in St. Albans, alleviated a large portion of the wait time that existed, particularly over on the other side of the state. So, from there, we were able to cut wait times. Now, up until just recently, if you went and sought help in the way of medically assisted treatment, meaning buprenorphine or methadone, that you would have to go through an intake and probably a day or two lag time or wait time to commence your treatment. So at this point, it was just announced that we are actually going to provide that service on the spot. My interest in opiates and my work is in the public defender's office. By the time I retired in 2015, I found that about 3 out of 5 of our clients were suffering from substance abuse disorder. And I would pick up, and people would literally be crying in my office for help. And I'd pick up the phone and I'd say, need to get somebody into treatment. Oh, sorry.
Do you have a bed? Do you have
60 days, yeah. I need to get somebody on medically assisted treatment. Oh, sorry, 6 months. So when you experience that firsthand, and it's been said many times, I heard it just on the news the other night, that when someone cries out for help, that's got to happen right then, right there. Because I knew that person was going to go back on the street and they're going to use street drugs and possibly continue on this cycle.
As you know, but on the mental health side, you've heard it, they run to the ER, and there's nowhere for them to go. I'm just curious, Vermont's a small state. Of course, in Maine, they have a really bad problem in a couple of far eastern counties. Is there areas or regions of the state where the crisis is more pronounced than not? I mean, like Bennington doesn't have the same problem that St. Albans or St. John's.
So a follow-up question to that would be is, if we agree that treatment needs to be more accessible and stigmas need to be removed, right? How would you recommend, as a legislator, how would you recommend funding that process? Because treatment's expensive. I mean, nobody's going to lie. You know what I mean? I mean, when I see these commercials on television, I'm looking at a cost of anywhere from $25,000 to $75,000 to treat one person through an addiction of one substance. So I mean, it can't be cheap. So how do you think, as a state legislator, how would we fund it?
I think that we should deregulate counselors. Not totally deregulate counselors, but I think we need to think outside of the box, and we could have recovery coaches, something like that. Not people with their doctorate degree that provide youth or anything like that. Not even people with master's degrees that are in the system now as counselors. But I know a great example is my partner. Her degree is in substance abuse counseling. She has to do, I think it's like 3,000 or 4,000 on the job training hours. She's already got her certificate, she's already got the education. And then she needs her licensure and all this stuff. I mean, she already has the education to help people recover. And I think that organizations such as yours could actually hire people like this under their watch to help people in recovery.
Like an apprenticeship program?
Sort of, but just we got a pool of recovering addicts that are doing for this. No one knows what people are going through better than an addict. So,
some follow-up question to Everett. Okay. You raised the question of the expense of doing it. Okay. You know the challenges we deal with in Vermont of the limited population size. There's an argument of a crisis of affordability, particularly for younger people, being able to stay in Vermont. How do you see the state being able to fund the expanded treatment plan that we all know would be ideal? But how do you conceptually see us funding?
We need to tighten our belts. For programs, I mean, right now, this day and age, the opioid crisis is one of the biggest crises we're facing in Vermont. So obviously, I think that funding should be put toward this instead of maybe some of the other programs we have.
So where might you cut?
Well, we've got legalized marijuana. That's
you think a tax and regulate system with that?
That's untapped income. We had money from big tobacco, but we figured out a way to spend it already. So I mean, we have resources. We have existing taxes that we could utilize. It's just a matter of taking a look at the programs we need and the programs we don't need. We funded. Another great example is we funded Vermont Life for like 3 or 4 years, the magazine, and it was a sinking ship. It was losing money every year. So instead of investing in these sinking ships, we can take the money from these sinking ships and put them toward.
I think it's just a question of prioritization of capital.
Right. And I think. I also think you solve some of the other problems on the list. You might see a decrease in addiction as well. People, from what I've seen, and correct me if I'm wrong, they use because they're missing something, or maybe their life conditions really aren't that great. It's an escape.
Like poverty.
Like poverty.
Right.
Poverty is a great example. So I think like I said, I don't know all the programs that we fund right now, but I definitely think that here's another great example. We just voted a bill to fund lake cleanup, $48 million to clean up Lake Champlain. I think that's important, but we're not addressing the problem of the municipalities that are dumping raw sewage into the lake every year. So we're going to clean up the lake with that money. I actually failed, so we're not going to, but this is what they're voting on. So we'd clean up the lake with that money, but we'd still have that problem. So instead of throwing money at a problem we can't fix, why don't we take that money and $48 million toward recovery would be a pretty good chunk of change.
Absolutely.
I don't think it would fund everything we need to fund, but and then maybe once they address the 800,000 gallons of raw sewage going into the lake, then maybe we can fund the lake cleanup. So it's because
failing infrastructure system, just one more of them.
Would be a place that policy could be made to help people with disabilities?
Well, certainly, I think a version of the work incentives, the bill, the federal legislation, the work incentives bill, which allowed for again, it wasn't a benefits cliff when they started getting into the workforce as disabled individuals, that we allow them to get into the workforce and keep their benefits, and as they grow, their incomes grow, and as they can buy their way out of the benefits, and then No, keep
So
going.
is
Yeah.
this different than what states are opting into now? The requiring work for Medicaid? I mean, are we talking about something else?
Well, our Medicaid, yeah, I don't know what other states. I know that there's some. There was under President Obama, there was the ability to expand Medicaid, and now some states are fighting about that expansion.
Right,
and
and some
was-
states are requiring
Right.
people
Work.
receiving benefits to work, and then if someone with disability, I understand it would be excluded. That's not what you're talking about.
No. And in fact, we have very expensive, some of the most expensive Medicaid benefits in the country. So that's not what. But when those with disabilities choose to get into the workforce, which so many of them want to.
Right.
Again, my tenants, and some of them aren't able to do, a traditional job, but they get help with their aid and what have you, and they go to their jobs and then they come back. And that's not what I'm talking about either. They maintain their disability benefits and Medicaid and Medicare.
And those are federal benefits we're talking about.
Medicaid is state generally,
But I mean,
state determined. But
you're not talking about Social Security.
no, that's right.
But there is that place where people,
Yes.
if they go to work, especially if they go to work more than 20, 30 hours a week, they start economically not qualifying for benefits the same way. So sometimes people, if they took a full-time job, they would immediately lose their Medicaid or lose food stamps or other kinds of benefits. Is that what you're talking about?
That's what I'm talking about, essentially. Yes, yeah. So they could, as they start to get more hours, get more experience working, really enjoy it, they don't lose their benefits. We can wean them off the benefits gradually if they start making more and more money. But that encourages, again, it was called work incentives because it really encourages those with disabilities to get out into the workforce as much as they can. So I think that's a policy that we have that we could look more at. It's just more of a challenge. It can be a challenge, but.
Thank you, Heidi.
Yeah.
So you got your minute to go and find another group?
So that concludes our first session. I know everybody looks very engaged, and you hate to kind of move on, but to keep the program moving. So if you can now move on to your second discussion, if I can have the candidates to stand up and hold up that you're going to be talking about the next round. Underway now, and we will be
So the question to start with is, why did you select this topic, and why does this issue matter to you? And we can move. We might want to just get a little closer.
Yeah, just
otherwise we're kind of yelling.
let's snuggle up. So why did I pick this topic, and why is public transportation important to me? Well, for a couple of reasons. Having a vehicle is a huge expense, especially for people that work far away from where they live. Public transportation is, if I talk specifically about Stowe, we have an issue with finding enough people to work at our businesses. And if you take a bus, you often have to show up like an hour before work starts. So we need more of that. Traffic is an issue. Parking is an issue. Parking is an issue. So I'm an immigrant. I grew up in Sweden. I grew up in a city with very well-functioning public transportation, so I know that it can work. We have different challenges here because we are a rural state. But I would love to see more community parking spaces with buses picking up. I think people would be interested in that. It would also make a difference for our carbon footprint, which is something that I care very much about, our environment. It's a much more effective way. You really cut your carbon footprint if you're commuting via public transportation.
And it has to be subsidized. There's no way public transportation doesn't work if everybody's paying the full cost. And I know several years ago they had a train from Shelburne up to Burlington that they were running as an experiment, and they stopped that project in less than a year, which is not enough time because it takes something to switch, right? It's so easy and comfortable to get in your car and just go. So it takes something for people to change that, and there's got to be enough incentive. And one of the biggest incentives is if it costs you less than driving your car every day. Some people will do it out of concerns for the environment, but that's not going to be the majority. And then it has to be convenient, so you don't have to wait an hour till your work starts, or wait an hour after you leave.
So open it up to questions or comments.
I got a whole bunch of questions.
All right, we'll do one at a time, and then
Yeah,
we'll
absolutely, absolutely. So, Ms. Meerberg, so what I'm hearing is one, you're European by birth, and you understand that public transportation, if properly funded, if properly utilized, will work. Now, I've lived all over the world, so I've seen the success of public transportation in Europe, South America, and Asia. So I understand it. As a former employee of the CSX Transportation, which is a railroad here in the United States, I agree with you about the importance of rail transportation. And I'm so glad you've mentioned this, because I know that a lot of people that live in Essex County, which is at the far northeast part of the state of the Northeast Kingdom, have to oftentimes travel over 120 minutes to work in Burlington via automobile or by commuter bus service daily. Have you been up to Essex County yet?
I have been up to Northeast Kingdom, so you got to help me with the counties. I remember.
Okay,
I know the towns.
so you have like Island Pond.
Yeah.
Okay, so you've been to Island Pond. So then you are aware of the Grand Trunk Terminal there, right? The rail terminal.
Right.
I'm so glad that you've noticed that, right? So this rail terminal goes through to Holland, and from Holland it goes to Derby, and from Derby it goes to Newport, and from Newport it actually continues along this corridor which straddles the border, the international border between Canada and the United States, and will go all the way to Grand Island County, right? Where it picks up on another trunk line, which will run down through Essex Junction, the Vermonter system, which links up to St. Albans, right? That being said, do you think as a legislature in Montpelier, would you explore possible options for commuter rail services connecting the NEK to the jobs in Chittenden County? Would you explore that? At least explore. I mean, not promise from me going, yeah, we want rail. No, just an idea just to explore the options. Could it be a realistic option?
It's definitely an idea that's worth exploring. Now, have they ripped up all the rail? Because I know the rail is still there.
It's still being used. It's still being used by the Pennsylvania-Wyoming Railroad, which is part of the Grand Trunk Railway system. If you know who they are, like the parent company is called the Genesee and Wyoming Railroad, and they're like what's called a Class 3 line, the largest Class 3 line in North America, right? There's Class 1, Class 2, Class 3 railroads as far as freight goes, right? Amtrak leases Class 1, Class 2, and Class 3 railroad trackage from these railroads in order to move passenger rail. A possible Vermont Rail Authority that would run passenger rail could possibly do the same for the Genesee and Wyoming. That's why I asked that, because it's possible, legally possible, and physically possible.
It's a very interesting point that you bring up. I mean, rail is fantastic and it's green. It is expensive to invest in, so I can't make any promises without knowing, where that's going to end up. But I'm glad that you bring it up.
But you would explore the issues if elected, correct? Thank you.
So my issue.
I think it's an incredibly big issue, no matter what. You work for Lamoille Mental Health. You're here on behalf of them.
Yes. Tom Anderson, I'm the Commissioner of Public Safety for the state of Vermont. Substance abuse is basically all-consuming to what we're doing in public safety.
I think most recently is the Digger article on opioids and child abuse and what that looks like in different districts of the state. That's most recently on my brain because it came out 2 days ago or whatever. most recent article, but I think we spent a lot of money on substance abuse, and I don't think we're gaining enough traction.
You don't think we're gaining?
Gaining enough traction. We haven't turned the corner. We haven't turned the corner yet.
I serve on the fire department, and we get a lot of overdose calls. So I'm just curious to hear what your thoughts on the issue are.
I'm running for assistant judge in Lamoille County, and I've been hearing a lot of cases around substance abuse in family court and civil community action. I'm also been a guardian ad litem in Lamoille County, so a lot of kids being removed because of substance abuse issues, and particularly concerned about the public health issue of used syringes being found everywhere now. And even in pristine Stowe, they're being found, and communities taking responsibility to provide maybe receptacles, safe receptacles for used syringes, and admitting they have a problem. That is probably not just tourists. Probably is a problem, particularly in Stowe. So that's why I'm here.
I'm the assistant director and next director of Lamoille County's Recovery Center, North Central Vermont Recovery Center. So we represent all of Lamoille County, and I'd love to comment on that because we are working on a system with Sharon Marco to be able to lift every safe syringe, not just from substance abuse, but from also people who are using it for diabetes and other things, and to be able to, we will first of all building receptacles, but also we will have a syringe disposal unit every first Monday of every month, and we'll be able to take up to 50 pounds every month, every first Monday of every month. So there are measures already being taken to increase public safety in Lamoille County, as in Washington County, as in Chittenden County. So we're already way ahead of you on that stuff, but the work is being done. So, and I think we are turning the corner. Excited to hear more about what you thought.
Yeah, I would just make the comment on that. I understand that the feel is that we aren't doing well in that. We're nearly at the bottom of the country in the death rate for people with addiction, and we are at this point, the hub and spoke idea of being able to have the treatment places and places to deal with those people that are addicted. We opened the hub and spoke in St. Albans. We have no waiting. Our waiting lists have dropped dramatically now, and so we definitely could do better, but I think we jumped on the issue quicker than other places in the country, and I agree, it feels like we're not winning, but we aren't the worst place in the country.
So I'm a Stowe resident. I'm relatively new to Vermont. I've been here less than 2 years. But my interest in this issue, unfortunately, is personal.
Okay. Well, that's perfectly legit.
And truth be told, I'm a Massachusetts resident currently, but I'm her boyfriend and in the process of moving up. So her personal interest is also my personal interest. And I've just witnessed in Massachusetts what a horrible job we're doing down there, and I'm kind of curious to see what's going on here.
So, my interest in the legislature mostly has come around the Appropriations Committee, mostly the funding for the hub and spoke stuff recently. But we also put money in the budget to work towards the idea of a drug court and to move in that direction in the past year. Personally, and I think this probably exemplifies the thinking around what some of us that have pushed that idea. We approach it that somebody that's addicted have up to this point a criminal, and I think it's a difference in philosophy in places. In Portugal, the Portuguese, the word for addiction means enslaved. And I think there is a whole piece of the change in the way that this country is beginning to think about how you deal with somebody with an addiction is that this is not really a criminal act in the same way that everybody would originally have figured about it. But if you think about the person as they've been caught in a situation where they may have done something off to get themselves there, but they're now caught in a way where they can't get out of this trap for them. I think that's where the initiatives in, particularly out of the Senate this past year, have started to put us to think about more of a drug court.
Well, I know Chittenden has one, and I was interested in that too. For Lamoille, I was told there's no money for it, you know. But you're saying it may be.
Well, we're you know, there's initial money to start out a rollout of all of that, and to start that process of that thinking around the courts and that.
They can mean different things in different, like, you know, the federal system, the drug court is post-conviction. It's generally post-conviction. So the pretrial intervention is diversion. So if you have somebody that's addicted, you're trying to divert them out of the criminal justice.
And that's what we're working.
That's exactly what we're talking about.
Yeah, the court gets a lot of different definitions.
No, but
and it often gets confused with a pretrial release kind of program. Drug court in the federal system is post-conviction. People coming out, you know, that have had some convictions and substance abuse problems, and then dealt with
I was sorry.
So, since you're the person that works in this every day, can you tell us a little bit about what's going on at Recovery Center?
I mean, honestly, I think
because we have tried the last couple of years to push more money towards the recovery centers and boost their funding.
First of all, I'll say that I'm working hard to make Lamoille County an example for the rest of the state. You know, typically, you know, we're trying things to try to show others what can be done in terms of drug courts and community collaboratives. Rutland and Chittenden County led the way. St. Johnsbury, you know, our recovery center was the first to partner with Vermont Cares to have a mobile syringe exchange and sharps disposal, but also reduce deaths. We've lost 2 people that we knew in the last month to overdoses. I saved a guy who hit the DeMars carriage barn. Myself, I ran out of the recovery center and went over and pulled him out of his vehicle with Connie DeMars. And, you know, we deal with this every day of people in acute distress. I'm excited to let you guys know that we just received a grant to be able to do recovery coaching in the emergency department, which means every person who's admitted related to substance use, I'll have an opportunity with my team of recovery coaches to try to move them on from that place into a better direction to help them move forward in their lives and recovery and get help that they need and provide resources. So and that's will be the 5th in the state, 5th entity, 4th recovery center, and that will spread around the state. So things are in play right now that have never been in play before.
Is that in the emergency room
at Copley Hospital? Yes. So
because I'm on the board at Copley.
There you go.
And I chair the finance committee.
Yeah.
And one of the fastest growing areas of our budget is violent people coming into the emergency room and having to contract with, we have a contract with the Sheriff's Department to provide services in that. And we're one of the few hospitals now that doesn't have a separate lockdown room for people violent people coming in, and they're mostly around substance abuse.
Yeah, and that requires a different level of engagement and training, and for some people who present with violent, belligerent tendencies, that requires different care. We deal largely with post-overdose and people with acute alcohol toxicity and certainly some co-occurring mental disorders, but maybe not quite that acute. But our hope, like Copley Hospital last year, saw over 200 instances of people admitted inpatient over and over and over again related to substance use, and our hope is to provide care that will make it so that they don't end up back there.
Well, if you walk into Lamoille County Mental Health now, the front room that you walk down is a totally glassed area that is to hold anybody violent out from it, and they don't have the wherewithal to deal with them there, so they ship them over to the hospital. And the hospital, their only dealing with that has been to this point to lock people up and basically ship them to St. Johnsbury or St. Johnsbury. I thought it was mostly St. Albans that we were sending.
I deal with people pretty regularly. Like today I had a woman who basically went on a 6-week bender and ended up in jail in St. Johnsbury only to detox and almost die and end up back where she began in the first place. So our system is as we improve communication and coordination, a lot of these weird and hugely costly things that we've done with people related to the criminal justice system and how we treat people will improve, I think.
I would love to hear from destroying the apartment, destroying property. So, charging each of those crimes when appropriate. So that when I go before the judge and say, Judge, this isn't somebody that's having a bad day. This is somebody that is, he's back in his criminal ways, and we need to set bail, or we need to do more harsh conditions in terms of a 24-hour curfew, which you might not want as a landlord. As a landlord, you might not want a 24-hour curfew, but doing things like that, doing 24-hour curfew, doing electronic monitoring, ensuring that they're getting, if they're addicted again, seeing if we can get them back in treatment. I think there's a lot of tools we can use as prosecutors, but I think it is kind of a stat. I think we get more credibility with the judge when you kind of establish this as a pattern of behavior, and you're not coming in. It sounds like in your situation, everything is kind of falling apart and being like, oh, he's bad. You kind of get established. So I think that's definitely what you see. Well, I tend to try to set up my CPs so that if you're violating probation or parole, it's automatic, you're probably headed back to jail. So I try to do structure like that. Understanding that with addicts that you do have hiccups in the road in terms of treatment. The first violation, I'm not sending you to, sending you to jail. But, this constant disregard for the law and for others, there comes a point where it's like, okay, we had this sentence structure for a reason, and now we need to go serve the time. That was part of it.
Other questions from this group? Also, corrections.
Yes.
Without any clue that this guy was like.
Yeah.
There's a little difference between he was busted for a little car.
Right. Yeah, and that's a problem.
It's not just the state's attorney's office.
Yeah, it's the system. Yeah.
It's the community. Questions? I had a question. In Lamoille County,
Sheriff Mark Quez working from. I think they have a bigger staff.
You think that's a bigger staff?
Yeah, I think they have.
Because I've heard him say that he doesn't have enough deputies.
Yes, I know that. All law enforcement wants more patrol officers.
Right. Then he can't patrol certain areas because. So how would you? What would be your position?
So I think that I think there's a balance. Obviously, you don't want to to over-police and sort of make the, you don't want to sort of create sort of fear in the community. But, I think resources, I do think resources are tight in Vermont. So, I think I'm always for getting a few more officers. I think it's, police here have a really tough job. Sometimes, they've just arrested somebody for domestic violence. It's 3 in the morning, and they're literally the only person in the office, and they're trying to control, maybe the individual's drunk or high, and they're trying to control that individual as they're trying to report charges, and, it's a tough system. So I think more resources, more law enforcement resources would be great, but I think that's probably a chat with Montpelier.
It's a good question. Unfortunately, it comes down to a lot of funding, to make our communities more accessible to comply with the Americans with Disabilities Act. I think that is probably a big portion. How do we keep people in their homes? Even just looking at our built environment and sidewalks and access to transportation is probably one of our biggest hurdles that we need to figure out.
We could solve a lot of problems, right?
Pardon me?
If money was no object.
Money was no object. We could solve a lot of problems. We'd probably have a lot more problems also, but.
But also, how do you integrate people into the community? To me, that's the biggest problem. Is how do we how do we make people full members, allow people to be full members of the community?
Yeah, and I think it's just, starting with our schools and really making sure our children are taught to be acceptable of everybody, regardless of everything, and just to be acceptable and not look down on anybody.
That would be nice.
I know, wouldn't it?
I've had the unfortunate experience in the last 6 weeks of having broken my leg and be dealing with mobility issues to really recognize how challenging it is in so many locations to deal with.
And you vote in Stowe? Because, ballot measure number 1 is sidewalks.
I know.
I'm just saying.
Yeah. No, I've been
good for you.
I've been dealing with this
I'm
for
obsessed with the ballot measures.
All right.
So but that's you start to see, and so when you're looking at the aging disability, the challenges to mobility.
In rural communities, transportation is a huge problem. Being able to get around.
We have an accessibility issue anyway, right? But then you add disability on top of that.
With this question, I was wondering, are you familiar with the proposed carbon tax and how that will affect public transportation? Will that detract from the existing public transportation that we have now because of enormous fuel costs?
So, kind of 2 different answers for that. My concern with the carbon tax is that I see it particularly being for older Vermonters that do drive. I see the carbon tax very difficult if you are already on a fixed income to have your expense for your own transportation. So I think the carbon tax is really kind of having 2 opposite effects where for lower income people who live in those rural areas and rural Vermonters, it can be particularly damaging. But then if we know that public transportation usage increases, prices increase. So I think that since the carbon tax kind of is pulling in 2 different directions as far as whether it's benefiting older Vermonters or not. But I think the immediate effect is that it's challenging for older Vermonters who are operating on a fixed income and trying to provide their own transportation for months into the I would be interested if someone has a different opinion.
I was just told that we have 2 minutes. Does anybody have one final question?
I wanted to ask Kathy what's your view on how the Central Vermont Council on Aging works with your agency to help meet your challenges? Or
I can say we're lucky in Lamoille County because we work closely together. So they case manage some of those highest needs people. And they call, sometimes we staff it with our personal care attendants, and they case manage it. But honestly, they call us, we call them. It's smooth. It's smooth.
So
sorry to have bring it up to you before. I just want to make sure that there's a follow that.
Do any of you, the other thing I'm interested in that I'm not sure what we need for is thinking about services, which maybe this is a question for you specifically for the Vermonters. Do any of you have specific thoughts on what the next step forward is work we're working on?
So in the past few years, I think there has been a very deliberate effort in terms of educating folks because oftentimes, that was always something stigma was attached to it. And folks did not want to come out and say, I'm not feeling good today, or I'm feeling down, or I'm feeling depressed, or whatever. And however, what we are finding, and we've actually started to talk to the Manor, especially in terms of finding out if there are any needs there for us to come in to see if there's any need. Because discussions, we've heard that there's some situations that are hard. So we are starting that education process and services to mental health is voluntary. You have to see, recognize that you need some help.
So that concludes our second of 3 sessions. So once again, if we can have our candidates, you're right on top of it. Good job. Again, this is our third and final session.
So I guess, Zach, if you would just start by talking about early care and education, what that topic means to you, and why it's important to your platform.
Absolutely. So yeah, early care and education, we're talking about children at this point, and the way I think of them is they're very much like a sponge. They absorb a significant amount of what is around them, whether it's behaviors, philosophies, nutritional ideas, and however it's what they're going to end up growing into is based on the examples set around them. And a huge part of education for me, I like to think of Abraham Maslow's hierarchy of needs. So as long as our base needs are met, you're going to be more apt to want to learn. If you are hungry, you don't really care how to do algebra or any basic math. So we need to make sure the basic needs are met, your sense of security is met, so that you can actually be involved and want to participate in learning and growing. I think that is utterly essential for any sense of growth going forward.
Go ahead, Talia.
So, I'm with you. I think children are the foundations of the future, and if we don't have that strong foundation, nothing else would flow the way it should. In the work that I do, one of the things that I have seen recently, and it's really heart-wrenching, sometimes situations that you have to deal with that involve children. In this county, I can tell you, over the past few years, we've seen little kids needing more behavioral health, mental health, and I ask, or they're on the autism spectrum, and I'm asking myself why. Why is this happening? What are we as a society not doing? Because we live here in Lamoille, in a very rural and probably one of the most poverty-stricken counties in the state of Vermont. What can we do we are providers, we try to do the best we can as a community to make sure that these angels, I call them, because they do coming into life. We brought them here and they expect to be safe, or at least we could do for them. They expect to have some kind of something to look forward to, as you said, food, housing, clothing. And those are fundamental, basic human rights needs that we do. And so what are your thoughts to do
for those folks. I mean, and they come from families that are also very troubled. We go into their homes because at this stage, what we are doing is we are going into people's homes and not. We don't want to treat. We want to prevent this from going further. That's where we are. We want to prevent.
Can I ask you what you do?
I'm the CEO of Lamoille County Mental Health Services.
Lamoille
County Mental Health Services
Right.
here in Morrisville.
Yeah. I mean, as far as, well, one thing that stands out to me, and I don't know if this is prevalent and happening everywhere, but one of my concerns is an unhealthy relationship with the internet. And if our phones or tablets are being used as a babysitter in a sense, I'd say that could potentially be quite dangerous, because I think what we really need is to have human interaction, human involvement with friends, family, throughout that child's life and when they're growing up. If they feel isolated or they have poor examples in their world, I don't think that they're going to evolve and mature in a healthy way. So I mean, that's one of my concerns, because we're living in the information age, and I'd say as a human race we're still very immature in how to handle and work with and deal with that. And I think that that's one thing that we could do. I mean, besides just meeting the basic needs and making sure they have their basic needs, then it's a matter of what are they going to do and step up and move forward with their life, and what examples do they have to look to. And I think that we're living in an increasingly isolated age where we say that we're very, very connected, and we are in many ways, internet, telephones and whatnot, but it's still very isolated in that sense, and I think that is very damaging to mental health.
In our committee, we tried to see what we could do to get more money for RCT. For public transportation around here, and it's just such a problem with such a rural state. I mean, you got to drive 5 miles to get 2 people to get on the bus,
This is why the electric car initiative is not going to be in this state. We have people who live at elevation and people who live at sea level, but we are not going to be able to obtain a charging station in the middle of the woods for an electric car. I mean, it's absurd to even say that we're going to be able to go that way in this state.
Well, it's
buses, yes. I can
not expecting the whole.
Gary, is that money one-time money?
It is.
So it was the 18, and that's it.
So I wonder. So one of the things I just went to.
We got to kind of tie it into.
Right, and I'm going to do that. I am doing that because that's near and dear to me. I'm with Head Start,
Capstone. I have a problem not doing that. I'm speaking more for myself than I am you.
So one of the thoughts I had, and I just went to another public transportation because it is a huge piece. I feel like that's one huge obstacle, because if we're trying to support people in getting work and having affordable housing, obviously they need to get back and forth and be it. So one of the things I do see, as you said, is the lack of public transportation between the towns in Lamoille County, making it easy, a regular route, a regular time. And I feel like perhaps that little things have been tried and the ridership was low, but I feel like nothing has really given it a long enough chance that people catch on to the fact that it's here. And people can, like a couple people, and they're like, it's not worth the route because there's only 2 people picking it up. But it needs to be consistent for quite a little while before people start realizing they can use this and they feel comfortable and they know it's a consistent thing and it'll happen. I feel like it's my one time that my daughter tried to take the bus from Morrisville to Waterbury and then go to Burlington. It took her a lot to say, okay, I'm going to do this. And she went to the gazebo in Morrisville and the bus drove right by her. And she was on time. She was early. And that blew that. That was that. So just the fear of it not being a consistent thing, plus the fact that it would be nice to have midday trips. I know it turns off, right, doesn't run during the middle of the day, and it's like fitting a puzzle together with inconsistent and again, even I don't know if there is transportation now from Johnson State to Marshall. I don't know if that ever happened. I mean, why wouldn't that happen? Why couldn't they have buses from the college over to where the stores are? And
I tried to find out the routes today, and I ran out of time between my paying job and doing this.
I can look up some routes for you. They're not very, they're very
inconsistent.
Scarce.
But there again,
no weekend transportation.
Right.
Noon hour, no transportation.
I agree with you.
No, that's fine. I told you.
Given time, it probably would work, but people have to adjust their schedules as well as the bus routes have to adjust theirs. Because one of my daughters lives in Cabot, and she drives to Marshfield. She works for the state. She works for the Department of Agriculture, and she drives to Marshfield and picks up the bus there. And she can ride down and back because she's a state employee for 80 cents. No way she can drive for 80 cents.
Right.
From Marshfield to Montpelier and back.
That's a resource specifically for state employees?
No, she gets the rate because she is a state employee.
Okay.
Now, whether the state subsidizes that or not, I have no idea.
Well, it's just that there's not even, we can't even begin to talk about that kind of stuff in this area because we just don't have the transportation between the towns.
And with corporate jobs, you can't readjust your schedule if you're scheduled at 1 o'clock in the afternoon.
But that's what I'm saying is, like, with her, she had to adjust her schedule, her work schedule a little bit to make it fit the bus schedule.
I think people would be reasonable if there was a regular hour and, I'm going to get to work a half an hour early every day or 45 minutes early, but I can get there by bus. I think people would be reasonable about that. There's just little transportation to the short distances, that are just, I'm saying short. Like if I needed to if I worked in Hyde Park or, I needed to get to Johnson or I needed to get to any of the places, just a regular, even hourly. I mean, I don't know. I feel like we could do some.
Well, so we talked about that there was this specific settlement money, that was last year. Are there other policies here that you have seen or heard that might address, because I think we're hearing some a few different concerns that come up, or other funding sources that might be able to provide a more consistent transportation. So policies, funding, anything else that you're seeing that maybe is...
There is line items for public transportation within the budget. And, there you've got 250 miles from top to bottom here, and you've got all these different agencies and people that are trying to get funding out of a pot this big, really. That's why I got to go back to, you got to grow the economy. We got to get more money. You got to get more tax money coming in.
But you also need to get the people working, and if they can't get to their job,
there's jobs available. But I think particularly for folks that we're working with in the human services, it's really, my day goes a lot better because I like the work I do, and I'm passionate about it. It's fulfilling for me. So I think there's one thing to get somebody into a position or to say here's a job. I'll take my nephew, for example, who turned 18 last winter, and he's on the autism spectrum. And through school and even now, he's not in this community, but it was go work in the local hospital, clearing dishes, in the kitchen or in the cafeteria or whatever. He is an avid movie freak. He there's so much stuff that he loves and is passionate about and is brilliant about. Why isn't he working in a movie theater? Why isn't he, but no, it's here's the job clearing tables, or stacking the cups. And I just think we could do so much better.
I certainly think the Department of Labor can do much better, because I think that's kind of one of the problems too. Is when you get somebody who's looking for a job, you just try to find them a job as quick as possible.
Right.
And it's not. There should be a little bit of a sorting going on, and what do you actually want to do? What do you like to do?
Exactly.
And that could actually lead to. The first job may not be the best job in the world, but it could lead to a fulfilling career.
At least if there's one aspect of something that they're really interested in, that might be enough of a carrot to
exactly.
keep the trail happening.
Exactly.
wish there was something like an application people could fill out to connect them to those types of jobs. So like, yes, they have a disability, but what are their interests?
Right.
And then what exists out there, so that could kind of bring them in. Right. And then there's the transportation part of it too, because I know a lot of people with disabilities also may not be able to, drive themselves or have somebody that can. So I wanted to know what was being done in the supportive.
Oh, we were just talking about that. Public transportation has been a real issue in Vermont forever. Really, it's not easy in a rural community to provide busing that's effectively used. It's hard to pitch the funding when there's only one person on the bus or something, But then you say, well, there's other options. Well, not everyone has a wheelchair ramp to get into the van, so you kind of need that van to get those people that need some support in their employment to get to their place. And so no, that is a nut that hasn't been cracked yet, and it's not going to be an easy one. And so we were talking about before too. Now the private sector is getting involved. Like Lyft is available statewide if you can pay for it, but if you can't pay for it, then that's not going to help you. But then again, they can't. The privates aren't going to be able to give those services like a wheelchair ramp or somebody whose health is not as stable. They're not going to be able. They can't take those because they won't know what to do, or they might not even have the skills or the equipment to do that. So public transportation. We don't know what is going to happen, and it's we talk about it a lot.
Yeah, because I know that's like a big factor too in getting people with disabilities to their jobs, even if they can find them.
Right. Well, and plus, so if a person with disabilities living with their parents might have that equipment and the ability to do it, but they may not be there all the time.
They may be working.
So it's a real conundrum. That's an ongoing battle.
And it's interesting, it didn't come up as much in the last topic about public transportation in terms of just how challenging of an issue it is for folks that maybe aren't marginalized, don't have disabilities, just for the general population. And then you add in this, whether it's accessibility, whether it's developmental delay, whatever it might be, and it's almost, I don't want to say impossible, but
It's an added challenge, that's for sure.
I mean, and people seem to always, since forever, I think people have had real high hopes for public transportation, like even back in the 50s and 60s, and it still hasn't materialized really anywhere in Vermont. And you couldn't have Burlington as an exception, but I don't want to even call that real public transportation either. That's they make circles around the city. That doesn't help me who's trying to get there for a day and then come back. It'll be interesting if somebody can come up with a plan that can stick. Because things have come up in the past, and there has been initiatives to get it going, but they seem to peter out fairly quickly.
What about a gas tax?
The carbon tax?
Or a gas tax, just on people fueling up their cars.
To pay for public transportation?
Right, so you tack on an extra penny or two on say like a gallon of gas, and then use those funds to pay the
That's a better plan than the plan they have now, I think.
Not that I want to pay any more for
I know.
But if there's something that could directly tie into transportation
Right.
I think people might balk at that so much.
Right. No, it is true. So the current plan is essentially taxes so people will use it less. And we live in a rural community. There's no using it less.
We don't have an option to
use
the vehicle.
Exactly. We can't ride our bike and we can't take the bus.
And I don't know the data. I have no idea how many cars they refurbish and give away every year, but I think things like the Good News Garage, helping people become actually self-sufficient and not, I think improving the public transportation system is a worthy cause and it's worth looking at, but I also think people having their own, unfortunately, yes, it is more vehicles and it's more pollution, I'm sure, and whatever, but we live in rural Vermont. I mean, people need to get their kids places and get themselves places and whatever, and having more potential, programs where cars can be donated, refurbished, given away, whatever, I think could be really helpful.
And I can see supported employment and transportation definitely.
Oh, they definitely do.
Yeah.
one right the other.
And then you have housing. That's the third,
All of it's coming together.
Oh, yeah.
And if one of those pieces falls apart, it all kind of falls apart.
Yeah.
So, off of substance abuse, since I've heard nothing but that, safe communities. How would you feel about towns forming their own neighborhood watches? Like, a volunteer maybe walk up the street at 10 o'clock at night. Just go for a walk up your block. Go back to your house. If you see anything, say something.
I would support that. I think, we do have to watch out for our neighbors. I certainly do. My neighbor is 300 yards from me across the road, but I'm looking out the window when there's a car that pulls in the driveway that I haven't seen, and she does the same for me. So I think that's important. I don't want a Trayvon Martin issue where some vigilante is shooting somebody.
No.
But I think we as members of communities have to be helpful and responsible to one another, whether it's formed as a neighborhood watch or
network of people that just care, something.
Yeah, and just communicate.
Because Marge Ward, the other 2 weeks ago, there was this man, I won't give a description or anything, but he was hawking his wares on our street, and she came out of her house. Much bigger, gave him the business and said, "You get the hell off my street, and I don't ever want to see you here." And we haven't seen the guy since, so I think a little community participation might make our streets a little safer too. Stand up to them, don't let them just walk all over. If they look dangerous, call the police.
If it can be done in a safe way, that would be my concern.
Something I've been following your race pretty closely, and it's been defined largely by being Paul or not Paul. It's become about support for restorative justice and weighing victims versus criminal rights and just who we're protecting and who we're serving through restorative justice and trying to divert people from the worst penalties of their worst acts, And so I'm trying to kind of disentangle you guys as candidates from this whole conversation, because as human services agencies, we deal with people and with these ambiguities and with people both at their best moments and their worst moments and everything in between. And so I've been trying to read what I can that's come out and get a sense of who you are and what you believe in your role as state's attorney and in cooperation with human services, and basically trying to advocate for both victims of crimes and so forth, but also to build rehabilitative actions. And just where do you stand on that? And kind of trying to move on from this discussion of Paul's overuse of restorative justice.
Sure. Yeah.
Do you see what I'm getting at?
I do, and there certainly, there was a consensus in the communities that things weren't going great in the state's attorney's office. And so you're right, it was sort of like us against them kind of mentality in terms of looking for a change in the state's attorney's office. As I said to the last group, we talk about the fact that there's two candidates running for this position. If Betsy and I were diametrically opposed, then something would probably be wrong. Because if we're not focused on the same things in terms of perpetrator accountability, providing therapeutic services for victims and perpetrators as necessary, allowing opportunities to participate in restorative justice and preventive programs under appropriate circumstances, and holding the most egregious of criminal perpetrators accountable. If we're not on the same page, then something is seriously wrong. So we really are very similar in terms of our approaches. I think we want to see a little more aggressive prosecution of this kind of engagement. We want to take advantage of all of our community partners and what they can provide. I think the difference that sets us apart is the amount of experience that I have. I've been here, I've worked with the community partners here, we've been 2.5 years, I'm ready to get back in there with them and take advantage of everything that we have to offer and make those as well as possible. But we may differ a little bit in terms of how we would handle cases, but generally speaking, I don't think we're that far off. One issue that came up was whether or not I would be sponge particular cases. I said I would. Betsy, I don't know what her position is, so I leave that to you to decide.
Yeah, I mean, literally at this point, people are in jail for crimes that are no longer crimes.
Yeah, no, raising the minimum wage, which I support, at least for a permanent reactions. And also, there are a lot of issues with it that you can't perfect. For instance, if you work in a job that has good health benefits and maybe even retirement benefits, and you make $12 an hour, you're probably doing better than someone working at a job making $15 with none of those benefits. And how do you, and I'm just throwing those numbers out, I don't know what the differentiation is. But how do you move forward with something like that, especially when we're still living in a world that doesn't hear
It's education and time. It's education and time. You have to be educated and understand it's not how much you make, it's how much you keep and what you do with what you keep. There's somebody, as you said, makes $15, $20 an hour, and they still end up having less than somebody who's making 14, who plans, who's frugal, who understands it. But there's so many people who don't. It's just like the need is here. I've got to give it.
And that's part of the transition program, right? So if you're now at the point where you have a job and still have your benefits, when you go away, you don't have to earn money. So if you're a transitional program that does use education to provide that, what you're going to do is you're going to allocate students, how many budget, somebody who can't do that before they go home. It is a cycle. When you talk family services, it really is. The basic needs aren't met. I feel like here in the North County, there's a lot of mental health services, and those are fantastic services. But we're still, what's underneath most of those is the basic needs. So we are like, as we're still struggling with everything else that's going on down there. So until we figure out how to help them with basic necessities, with poverty, and then they slip away, and then they come back, and then they slip away, and then they come back. So how are we going to make it last? And I don't have the answers.
I don't either. It's very, I mean, if I was in charge of everything, we'd be doing things very differently, including shifts and changes for anybody to fully understand, including people who are trying to help people who need the help.
All right, so that is, and I say it very loosely, the bell. That would be our first suggestion for next year. Get a darn bell that we can all hear. So that wraps up these sessions. Now, before we all go leaving and all, I know that some of the ladies here, I mean, and you know, when you have a major news event, you have instant analysis. Well, these ladies, they've been eavesdropping on you. I hope you were careful what you said tonight, because it might end up on the board here. So I'm going to hand it over to Carol. They put together kind of what they got out of this evening, and then when they're done, I'm going to ask some of the facilitators that are here if they have anything to add, just so we have an idea. It just sounded like everybody was so engaged tonight. We always felt like, God, we have to ring the bell or whatever that was again, because everybody seemed engaged. We could have gone on for a long time. So I think that's a good barometer in how we did tonight. So let me hand it over to Carol, and she has kind of some results on what happened tonight.
Great job, everyone. So 3 of us took your gems from your conversations and tried to capture them and distill them to a very few number of words. And we may have missed some things, so we're going to give you an opportunity to shout out if we've missed something that seems really important. So what I'm going to do is just tell you what we've captured, and we tried not to make any judgments about any of them. They're simply words that we received from the facilitators. And then we're going to shout back out to the facilitators and see what you came up with in your third session, because we didn't pull from you, your third conversation. So this is from the first 2 rounds. Benefits cliff, supplemental package for workers. Hopefully that'll make sense to most people. Disabilities, keep people in their homes. The impact of poverty. Food, Meals on Wheels, school programs, and transportation all came within the conversation related to poverty. Criminal justice system reform had a lot of conversation. Balancing restorative justice and prosecution, bail and conditions of release reform, and the impact of substance use were the 3 that we identified. Older Vermonters. Some ideas that came out of that were needs of transportation, Meals on Wheels, dental care was a specific comment, and opportunities for connection for older Vermonters. The root causes of unsafe behavior: trauma, substance use, and mental health. Substance use, overdoses, increase in children in custody, crime, and the need for more recovery services. Mental and behavioral health had a lot of conversation. Some specific things mentioned were the impact on emergency department, and the system seems overwhelmed. I think we did this one a little disservice here. I think there were a lot more conversations there. Transportation, people with disabilities, needs beyond medical services, the impact of the carbon tax, that was mentioned a bunch of times, and access to services is impacted by lack of transportation. So keep in mind those were from the first 2 circles. So what we're going to do is we're going to go around and ask the facilitators, if you have a gem from your third conversation that you don't see reflected anywhere up here, we want to capture it. So we're going to start in the back with Sean and ask you, Sean, in your third conversation, is there anything, and if you can stand up and shout it out, if you need the mic, we can pass it back.
The way we were capturing it was sort of issues and proposed solutions as 2 separate lists of gems. And so, the theme of poverty and the lack of resources and funding constraints came up again as issues, but got into some interesting discussion about the rebalancing of income distribution, really looking at taking a hard look at that. Long-range incentive programs, investing in affordable housing and expanded income range. And then leveraging the strength of operationalized activist groups that already exist, starting to focus them on some of these issues. That was in the disabilities.
How do you want us to articulate that, Sean?
I'm sorry.
The disabilities, the housing and disabilities. How do you want us to say that?
So the idea came up of investing in affordable housing, having a state investing in affordable housing on an expanded income range. So rather than only the most, starting to look at expanded.
Perfect, got it, thank you. All right, Kat.
Our third platform had to do with youth becoming healthy adults.
And Betsy Anderson spoke about how she wants to be the kind of state's attorney that is out in the community, understanding not only the needs of our community partners, but in understanding the needs of our most vulnerable populations. She believes in coming into the schools and in starting conversations early about what's important to youth, and focusing on education and prevention of problems as they go through the cradle to beyond.
Stephanie.
Our topic was on safe, affordable housing this last time, and a couple of things that came out of it. One has a lot to do with rising housing costs, but not rising income levels, not rising to meet that. Of course, affordable housing and lack of affordable housing. And one topic that came up was about perhaps a state program that existed at one time that might help people pay that first, last, and security, which is a huge barrier. And then the person or family could pay that back over time. So those are a couple of
Great, thank you. Beth.
Our topic was older Vermonters, and we had some discussion about housing, affordable housing, and increasing home sharing options.
Nice, thank you.
So we were with Lucy Rogers today, and we were discussing safe communities this last session. Two big things and contributing factors are, of course, mental health and the opioid crisis. One thing that was addressed is that other states, especially tourism-driven states, they are covering up the opioid crisis more than they're addressing it, and that's something that we were concerned about. As far as mental health, we were looking for ways to increase availability of mental health services, particularly with youth. One of the things that was addressed was whether or not we can implement more in the schools themselves. And that's pretty much all. Oh, and cutting into art and enrichment programs as well. How that's affecting youth mental health. And the level of prescriptions that were given out over the past few years, specifically opiates.
Thanks, Will.
So I'm with Todd Shobe, and we a lot of our conversation, our third topic was substance abuse, but it was one of the threads in all of our three topics, and that Todd's belief in education and restorative justice, but also if there is somebody who has a repeated criminal record, that there needs to be firm prosecution of people, and that sometimes restorative justice is not necessarily going to resolve that situation. We talked about creating perhaps more town neighborhood watches where we're looking out for each other, we're acting more as a community, and addressing some of the trauma and some of the reasons why people end up in the criminal justice system because of behaviors that stem from something that happened earlier. So a heavier emphasis on education, a heavy emphasis on restorative justice, and a heavy emphasis on rehabilitation.
Great, thank you.
Right, we were with Matt Hill, and one thing I feel like didn't get captured before, because I probably didn't write it very well, was around early care education. And that our group talked about really investing early. Sometimes you don't see that short-term impact, but there's a real long-term impact. So starting kids off with a solid foundation early on is really important. I think a couple of other things, it was interesting. Some of our conversations were a little circular and connected over the three groups, and we talked a lot about housing, transportation, and employment, and how all three of those are so interconnected, and if any one of them falls apart, they all sort of fall apart. So that was interesting. And then also, our latest conversation was partially around that this is Human Services, we are nonprofits, and that we are all sort of funding poor and struggling, and sometimes sort of pitted against each other, and how that really shouldn't be the case. Great.
So I was partnered with Gary Nolan, and our last topic was public transportation. We talked about the reality that in our community, with quite a few people that spread out, over a lot of areas that transportation initiatives are going to need to be subsidized at some level, whether that's state, federal funding. We talked a little bit about the Volkswagen settlement and some support that that's going to provide. But whether we're talking about the airport or buses between towns, just because of our numbers, we're probably always going to need some kind of support to make those things happen. Also talk about the reality that sometimes we don't give some new initiatives enough time to really take root. So we try some new ideas, but by the time some people find out about them, we've killed it because it didn't seem to be utilized. So it sort of brought up, are we doing enough in terms of marketing and promoting of the resources we do have? And then some discussion about commuter rail that sort of exists in some parts of the state. Again, more from Chittenden County and down into Rutland and south from there. And are there some opportunities for something new and different for our
So I was with Adam, and we were talking about family services, and one topic that came up was the level of education that is required in order to support families on a provider level, and how college loan forgiveness would be a huge incentive, especially since maybe the wages don't always compensate for the need.
Thank you. Zach Mayo here on session 3, talked about early care and education. Some takeaways, we talked about Maslow's hierarchy of needs and how children, if their basic needs aren't met, it's hard for them to learn and grow. We talked about the things that we are not doing that seem to be causing the increase in childhood behavior and mental health issues, and why is that on the rise? What do we need to do to be more preventative? There's an unhealthy relationship with the internet, that kids are being raised and exposed at early ages to a market of media, and we're not sure how to really control that and what long-term impacts that has. The question of, can we repurpose some education funds to provide quality child care and early education programs? The reality is that we spend the most money per capita across the country, but we don't necessarily get the best results. So is there a way to balance that out a little bit? And then finally, this idea of stop talking about mental health, physical health, well-being, but just really talk about individual health care. And that counts. Does that say anything?
So I was paired with Dan Noyes, and our topic was substance use. And we focused a lot on the prevention end of the equation, wanting to make sure that prevention coalitions are funded well, and bringing student assistance professionals back into the schools. We talked a lot about the relatively low cost for the state around that and how much it can help. And we talked a lot about just using a public awareness campaign like the anti-smoking campaign as a way to get the word out about drug use early on to reduce stigma and increase the educational opportunities.
Thank you. Elizabeth Richie Westman, and we were talking about older Vermonters. I handed off my desk, but here's a couple things that I remember. The workers left behind in the wage struggle, a need for unique alternative transportation, better understanding or information around coordinating of resources. There are some great resources for websites that have good information, but how do people hear about them or know about them? And the need to encourage a balance between the young workforce and older Vermonters.
One thing ran actually through all three, and I think it especially emerged on the last one, was about creating more support in terms of housing for persons who have gone through recovery supports and treatment, and then really have a hard time finding a place to land, to live, and be able to get back into the community flow. So that was something that we really saw as lacking and could be helpful. I think the other piece was really around the substance use issue and the concern that we really this is an issue impacting families, impacting community safety, and we really need to continue to do what we've been doing. We have some very good services going on with both the treatment and the recovery center sides of the equation. And then finally, one piece I haven't heard anybody mention, so I'll make sure to mention it, which is we still need improved cell service, that there are still these parts of the county that people can't access services, can't access emergency assistance, et cetera, because of a lack of the cell service, which was a problem we were supposed to fix a long time ago.
Thank you. Jennifer, yes.
With Clarina, we were talking about behavioral health. Nobody told me I had to speak in front of everybody. I do it all the time, but so we would like to see community-based prevention measures for keeping people out of mental health crisis facilities. Some prevention, hopefully, and we were talking about how agencies can work better together to sort of streamline care and be more effective and efficient.
Is that, did we hit everyone?
I was just, so we're getting close to the 7:30 time, but as I was walking around and observing, of course, as you know, this is a unique format. This is the first time that any kind of a format of this type has been attempted. And first of all, I think we need to give all the human resources departments who helped put this all together a round of applause. I mean, I came in quite late, so they did all the work. I just get to talk, which is what I do. But I was just curious, without getting too lengthy, and I hope, Rebecca, this is okay, I was just going to ask what people thought of this new format. I don't want to go too long, but whoever is interested, Heidi? Oh, thumbs up, okay, all right. Anybody just had some quick comments, yes?
I thought it was great. I just wish there had been a way to connect more of the candidates I can actually vote for with the topics, but that's...
Right. Anybody else? But I think overall, it got around. It was almost like we were almost afraid to stop them after 15 minutes. They're all kind of engaged here. We had to get them away from each other. So overall, yes.
If anything, let's do it a little bit longer.
Start at 8 in the morning, you mean? 5 in the afternoon, lunch break, things like that. Well, you don't know. So we'll see how it goes. So, anybody else have any other comments? Rebecca, anything else that we need to? Aren't you in charge? I mean,
Just a big thank you
Yeah.
to everyone who took time out of their busy schedule to come, and the candidates. Wish you all luck.
Yep.
Wish you can all have luck, I guess.
And be sure, and of course, if you, and of course, if you haven't voted yet, which maybe you already have with early voting, of course, the election is, as we all know, is 1 week from today, and let's continue the respectful campaigning